Welcome to this presentation on developments in HealthORI metadata standards. My name is Hanna Nijkes and I am presenting also on behalf of Niek van Ulse and Anna Conrad. The National Architecture Model, metadata is needed to describe datasets in the National Health Data Catalogue. The subject of this presentation is part of the solution Reporting Health Data One Time for Multiple Use in the OVT. Furthermore, this presentation can be placed in Deliverable 1 of the Plateau Planning of 2024. More information is also findable under Metadata Onboarding in the National Health Data Catalogue in the HealthORI Wiki. This wiki page provides general information about metadata onboarding for a broad audience. Furthermore, these pages link to the Data Team Wiki and GitHub, where more technical details and specifications of metadata and metadata onboarding can be found. These pages are frequently updated according to the latest developments. The Sunflower model reflects the different layers of metadata to describe datasets in the National Health Data Catalogue. The core metadata is relevant for all types of health-related data, whereas the petals reflect the domain-specific metadata that is not applicable to all datasets. In the coming minutes, we will give you an update about the latest developments regarding core and domain-specific metadata at HealthORI. In 2024, together with a group of metadata experts from Hub and Nodes, we have worked on an extension of the core metadata schema. For this, we took into account the Dutch specification of the DCAT application profile, DCAT APNL, as well as the draft of Health DCAT AP, the health-specific extension of DCAT generated on EU level. In addition, we took into account the metadata requirements from nodes and several working groups, and by combining all these, we came to the second version of the core metadata schema, which includes a number of generic health-related metadata fields. In total, a bit more than 80 new metadata fields were added to the new metadata schema. Most of these were based on DCAT AP-NL and Health DCAT AP, including several generic health-related metadata fields. We also introduced two new classes, Project and Study, to reflect more complex structures in the core metadata, like we can find in cohort studies and multi-center biobanks. With the Project and Study class, we intend to cover metadata that is broader than the description of a single dataset. The Project class covers information, for example, about project funding or duration, and each project consists of one or multiple studies which describe the data collection and generation in more detail. Each study then generates a dataset which is described by the dataset class. Until the end of this year, we are working on the formalization of the second version of the core metadata schema. Once finished, data holders can start onboarding metadata to the National Health Data Catalogue based on the new metadata schema. We will support data holders in metadata mapping to the new model. Next year, with a bigger task force that combines both core and petal metadata work, we will also focus on new data types. And of course, these continuous developments will also take national and European requirements into account. In 2024, we have also started working on domain-specific metadata. In particular, we have written out the process to come to a petal. To improve the discovery of datasets in a catalog, domains might have additional domain-specific metadata wishes. Therefore, we may need some domain-specific metadata fields, the petals, on top of the core metadata schema. To help domains build such a metadata petal, we describe the process. For example, you can imagine that for omics dataset, a researcher is only interested in a specific type of omics, like proteomics. This omics-specific attribute is not covered in the core metadata schema. The same goes, for example, for imaging datasets, where a researcher may only be interested in datasets with CT scans. These information can be described with domain-specific metadata. The process for developing a domain-specific metadata schema can be divided in different steps. After an intake with HealthORI, the domain should bring some domain and metadata experts together that can collect metadata requirements. and also look into what has already been done in their domain. This can be combined into a semantic model or metadata schema, specifically for the domain. This part of the process is mainly on the domain, whereas the implementation into the catalog is primarily done by HealthRI together with the domain. In the past month, we've worked on the process description for domain-specific metadata, together with members from different HealthRI working groups. This description is now available on the Data Team Wiki. At the same time, the Omics and Imaging Working Group are already starting to develop their petal based on this process description. For the petals, we will finalize the process descriptions until the end of the year. After that, updates will be based on experiences by the domains. Domains can of course continue or start developing their petal with support from the hub. Once ready, we will work on the implementation of the petals into the catalog. In addition, next year we will also start working on data modeling. If you're interested to discuss more, we'd like to invite you to our breakout during the HealthRI information session on the 6th of December. What specific data types should be described, and how should we do this? And for the domains, is the petal-process clear enough? Also, metadata can be complicated. We'd like to know what do you need from the hub to work with the metadata. And of course, if you're interested in joining the modeling work next year, please let us know. Thank you very much for your attention, and we hope to speak to you at the 6th of December.